This is why many elderly people will not live past 80. If you are old, you need to see this now. Have you ever observed how certain men in their 70s and 80s continue to exude vitality, maintaining active bodies and keen minds, while others appear to diminish rapidly, becoming mere reflections of their former selves? What if I informed you that one of the most significant distinctions may be a topic that is rarely addressed in polite conversation, their relationship with self-pleasure? Certainly, masturbation, the subject that causes numerous males of your generation to move uncomfortably in their positions, could be a critical factor in your aging process. Medical research is uncovering unexpected connections between the health of men in their golden years and their regular sexual activity, which includes masturbation. For an inordinate number of males over the age of 55, sexual gratification is relegated to the past, a chapter that has been closed. This is due to physical changes, societal expectations, or relationship circumstances. Perhaps you have encountered a decrease in desire, difficulty maintaining erections, or you believe that self-pleasure is inappropriate for your age. It is possible that you have been influenced by discreet messages from society that sexuality has a finite lifespan, or, even worse, that you have been made to feel ashamed for preserving this aspect of your humanity. This abstinence from sexual expression is not solely about the absence of satisfaction, it signifies a fundamental rupture with a vital life force. This disconnection has far-reaching repercussions that extend beyond the boudoir and affect every aspect of your well-being. Men frequently encounter accelerated cognitive decline, a diminished immune response, and increased cardiovascular issues when they discontinue sexual expression, which includes masturbation. The hormonal advantages of consistent sexual activity, such as the release of endorphins, oxytocin, and testosterone, are essential for the preservation of mental health, bone density, and muscle mass. Additionally, the psychological consequences of sexual withdrawal can result in a diminished sense of identity and purpose, as well as isolation and depression. Many males are unaware that they are unknowingly expediting their own aging process by relinquishing this aspect of themselves. However, there is a positive development that the majority of healthcare providers are unwilling to disclose. Many of these negative trends can be reversed by reclaiming your relationship with self-pleasure, regardless of your age. Regular masturbation is not solely about temporary satisfaction. It is a comprehensive form of self-care that promotes the circulation of blood throughout the body, including the brain and essential organs. It assists in the preservation of neural pathways that are linked to pleasure and satisfaction, promotes hormonal equilibrium, and fortifies the muscles that are involved in sexual and urinary function. The most significant aspect is that it helps to establish a positive, affirming connection with your body during a period of life when many men experience a growing sense of alienation from their physical selves. The most surprising aspect is that the advantages of consistent self-pleasure for older males continue to be one of the most understated mysteries in medicine, despite the growing body of scientific evidence. What is the reason for the lack of widespread dissemination of this information to males in their 50s, 60s, 70s, and beyond? The solution is a multifaceted amalgamation of persistent misconceptions regarding sexuality and aging, healthcare blind spots, and cultural taboos. A revolutionary approach to male sexual health in later years challenges all that you may have been led to believe. This approach views sexual expression as an essential component of holistic health maintenance, particularly as we age, rather than an indulgence. I cordially invite you to remain with me for the duration of this video, as we delve into this essential yet underappreciated aspect of masculine health and longevity. By the conclusion, I will provide a comprehensive guide that is specifically tailored to men over 55. This guide will demonstrate how to securely and effectively integrate self-pleasure into your wellness routine, irrespective of your current health status or the presence of a partner. This is not merely about improving delight, it is about reclaiming a potent instrument for preserving your vitality and extending your healthy years. For the next few minutes, grant yourself the privilege of maintaining an open-minded perspective. The knowledge you acquire has the potential to revolutionize your sense of aging and extend the duration of your life, rather than merely the number of years. The primary reason why many men abandon self-pleasure as they age is not physical limitation, it is a fundamental misunderstanding about sexual health in later life. The persistent misconception that sexual desire naturally and entirely diminishes with age has been debunked by medical science. The actual events are considerably more intricate. The desire for physical delight and intimate connection is ingrained in our biology and remains constant throughout our lives, despite the fact that the expression of sexuality may evolve. The true culprit is a toxic combination of misinformation, cultural taboos, and healthcare systems that rarely address male sexuality beyond reproductive years or erectile dysfunction treatments. This has resulted in a dangerous knowledge gap that leaves men believing that their sexual selves must be surrendered to time. This misunderstanding is evident in a variety of ways. Numerous elderly men mistakenly believe that a decrease in spontaneous arousal or alterations in erection quality necessitate the cessation of sexual activity. Others internalize decades of religious or cultural messages that imply self-pleasure is somehow dishonorable or inappropriate, particularly in later years. Some individuals are under the impression that the preservation of sexual energy will ensure their vitality, despite the fact that science suggests the exact opposite. The assumption that sexual health is distinct from overall health is the most lamentable misunderstanding. In reality, these two systems are intricately connected and have a profound impact on one another throughout the lifespan. Consider your sexuality as a sophisticated musical instrument that necessitates consistent practice to maintain its tuning. In the same way that an unused piano develops rigid keys, diminished resonance, and deteriorating internal mechanisms, your sexual physiology responds to neglect in a similar manner. The vascular pathways that facilitate blood flow, the neural connections that process sensation, the hormonal systems that regulate desire, and the smooth muscles of the penis all necessitate consistent activation to preserve their functionality. These systems do not merely cease to function when they are inactive for extended periods. They initiate a process of atrophy that becomes increasingly challenging to reverse as time progresses. Misinformation is not the only factor contributing to this issue. The alteration of sexual expression with age is undoubtedly influenced by physical changes, such as diminished testosterone levels, medication adverse effects, chronic health conditions, and relationship changes. One's relationship with sexuality can be further complicated by psychological factors such as depression, performance anxiety, sorrow after losing a partner, or transitioning to retirement. Privacy concerns may be generated by environmental factors, such as living with family members or in assisted living facilities, which may discourage sexual expression. Without appropriate guidance and support, these factors can create a complex web of challenges that can be overpowering. Nevertheless, the good news is that these obstacles can be effectively resolved with the appropriate strategy. There is no expiration date for your sexual pleasure capacity. The male body continues to possess the capacity to experience sexual satisfaction into the 80s, 90s, and beyond, albeit in a manner that may differ from that of youth. The human nervous system's adaptability enables the development of new pathways for delight, even as others may undergo changes. Throughout their lives, males can preserve or reclaim this essential aspect of their humanity through the use of appropriate techniques, adaptations, and occasionally medical assistance, which can have a substantial impact on their overall health and longevity. This knowledge represents a paradigm shift for numerous males who have accepted a life of lack of enjoyment in their later years. Rather than accepting diminished delight as an inevitable consequence of aging, consider it a modifiable factor that you have more control over than you may realize. By comprehending the genuine causes of sexual withdrawal in senior men, we can systematically and intentionally address them, reopening a door that many men believed was perpetually closed. The process of reclaiming this aspect of oneself commences with the acknowledgement that it is a critical component of one's health and identity, irrespective of their age. The initial step in reclaiming this essential aspect of your health is to adopt a deliberate change in perspective, acknowledging that self-pleasure is not only permissible in your later years, but also advantageous. This mental restructuring is a potent form of treatment in its own right. Begin to perceive masturbation as a fundamental form of self-care, comparable to physical exercise or healthy nutrition, rather than as a subpar alternative to partnered sex or as inappropriate for one's age. This transition necessitates deliberately questioning the internalized messages that you may have acquired over the course of your life. Begin by recognizing that your body is still deserving of delight and that the preservation of sexual function is a legitimate health concern, not a frivolous indulgence or something to be embarrassed of. This paradigm adjustment offers advantages that surpass mere psychological improvements. Regular self-stimulation facilitates the maintenance of urinary function and the health of erectile tissue by increasing blood flow to the genital region. Research has demonstrated that men who ejaculate more frequently throughout their lifetimes have lower rates of prostate cancer. Specifically, some studies suggest that ejaculating 21 times or more per month provides the most robust protective benefits. The hormonal cascade that is initiated by arousal and orgasm reduces tension, enhances the quality of sleep, and offers natural pain alleviation through the release of endorphins. Sexual activity has the potential to provide some protection against cognitive decline by stimulating multiple brain regions and maintaining neural pathways. The positive cycle of enhanced overall health is facilitated by the synergistic effects of these physiological benefits. The implementation of this solution can be initiated in a straightforward and incremental manner. Begin by establishing a private, comfortable environment that allows you to explore without concern for interruptions. Schedule this investigation at a time when you are not hurried and have the energy to dedicate to it, treating it as a significant appointment with yourself. Begin with a delicate contact that emphasizes sensation rather than immediate arousal or orgasm. Rediscover your body with inquiry rather than judgment, observing any changes in sensations that may have occurred over time. As age progresses, it is crucial to apply an ample amount of lubricant, as natural lubrication frequently decreases. Consider upgrading to a lubricant that is specifically intended for sensitive skin, as this simple change can significantly enhance the comfort and delight of older men. This method is receiving more and more endorsement from medical research. In a 5-year longitudinal study conducted by the University of Finland, it was discovered that men aged 55 to 75 who engaged in regular sexual activity, including masturbation, exhibited significantly lower rates of cardiovascular issues and superior cognitive test scores than their non-sexually active counterparts. According to research conducted at the University of California, the production of neurohormones that enhance neuroplasticity and safeguard brain tissue is stimulated by consistent sexual activity. In 2019, a review published in the Journal of Sexual Medicine determined that consistent sexual expression in later life is associated with improved immune function, reduced all-cause mortality, and better management of age-related health conditions, regardless of other factors such as general physical activity or social engagement. Imagine waking up with a re-energized sense of vitality, feeling more in tune with your body rather than at variance with it. Visualize the joy of preserving this fundamental aspect of your humanity rather than relinquishing it to the passage of time. Take into account the potential enhancements to your demeanor, confidence, and overall sense of well-being that this reclamation could bring about. The advantages of this methodology are not limited to physical health for numerous men who adopt it. They indicate that they are experiencing a greater sense of self-awareness, greater engagement with life, and a greater sense of optimism regarding their future. Improved self-care in nutrition, exercise, and social connection is frequently the result of this renewed relationship with delight, which also serves to inspire positive changes in other domains. This method does not necessitate precision or duress. The objective is not to replicate the sexual experiences of youth, but rather to establish a new, suitable relationship with pleasure that is in accordance with your current body and circumstances. Many men discover that the act of removing performance expectations and instead concentrating on mindful enjoyment transforms what was previously a source of frustration into a consistent source of pleasure. It is important to bear in mind that progress may be incremental and that setbacks are a natural part of any health journey. The consistent message from men who have successfully implemented these changes is that patience and persistence produce remarkable results, frequently regaining a vital dimension of life that they had prematurely surrendered. The second critical element of reclaiming sexual wellness in later years is the adaptation of techniques to accommodate the natural changes in your body, which is built upon the foundation of mentality and fundamental practices. This is not about combating aging, rather, it is about collaborating with your evolving physiology. The mature male body exhibits a distinct response to its younger counterpart, necessitating more direct stimulation, prolonged arousal periods, and distinct types of contact. Rather than interpreting these changes as dysfunction, acknowledge them as natural shifts that necessitate adjustment. The transformation of frustration into satisfaction and the reopening of doors to enjoyment that may have been considered to be perpetually closed can be achieved by developing a repertoire of techniques that are specifically designed for the older masculine body. The advantages of this adaptive strategy are extensive and profound. By collaborating with your body, rather than against it, you can mitigate performance anxiety and enhance success, thereby establishing a positive feedback cycle of enjoyment and confidence. This customized method assists in the preservation of penile tissue health by providing appropriate stimulation that respects tissue sensitivity and facilitates blood flow. The neural pathways associated with arousal and delight are preserved through the combination of mental relaxation and physical techniques, which adhere to the rule of use it or lose it in neuroplasticity. This method, which is perhaps most significant, cultivates a compassionate relationship with your evolving body during a period of life in which many men feel alienated from their physical selves. Experimentation and discovery are the foundations of practical implementation. Enhanced lubrication methods with silicone-based products are frequently recommended for senior men, as they often provide superior comfort. If sensation loss is a concern, investigate warming lubricants that can enhance sensitivity. Try out various forms of stimulation, such as vibrating devices that are specifically designed for males. These devices can be especially beneficial if hand arthritis restricts manual dexterity or if more intense stimulation is required. Changes in position can enhance vascular flow and comfort. Attempt to adopt reclining positions that optimize circulation to the genital area and alleviate strain on the back and pelvis. Incorporate breathing techniques that promote relaxation and intensify sensation, such as taking steady, deep breaths during arousal and shorter breaths as ecstasy intensifies. The effectiveness of these adaptive approaches is supported by research conducted at sexual health clinics that specialize in older adults. Men who acquired age-appropriate self-stimulation techniques reported a 78% increase in satisfaction with their sexual lives and observed improvements in erectile function, even in the absence of medication, according to a clinical study conducted by the Masters and Johnson Institute. A study published in the International Journal of Impotence Research showed that men who had previously reported diminished sensation can increase penile sensitivity through regular, adapted self-stimulation. Furthermore, a 2020 study conducted by the University of Sydney demonstrated that senior men who incorporated vibrating devices into their regular self-pleasure regimens experienced enhanced spontaneous erections and reported higher quality of life scores than those who did not. Rather than concentrating solely on specific functions or dysfunctions, this integrated approach recognizes the entire individual. Although erectile medication is undoubtedly effective in the treatment of men's health, numerous men have found that these adaptive techniques reduce or eliminate their reliance on pharmaceuticals by addressing the underlying issues of blood flow, muscle tone, and neural pathway maintenance. Some individuals discover that these methods enhance the efficacy of medical treatments by complementing them. The integration of these adaptive techniques, fundamental practices, and mindset adjustments produces a comprehensive strategy that functions in a synergistic manner to preserve or re-establish sexual wellness in a manner that is not possible through isolated medical interventions. By adopting both the physical and psychological components of sexual health, you establish a sustainable practice that can adapt to your changing needs in the years ahead. Despite physical changes, men who adopt this comprehensive approach frequently report that their relationship with their sexuality is more fulfilling than it was in previous years. A greater appreciation for pleasure, a deeper connection with sensation, and liberation from the performance pressures that occasionally dominated their younger experiences are all descriptions that many individuals have provided. This matured sexuality, which is defined by presence, patience, and adaptation, is not a diminished version of adolescent experience, but rather a distinct and frequently more enriching aspect of human enjoyment that is accessible throughout one's life. The all-or-nothing approach to success is one of the most prevalent obstacles that senior men face when reclaiming their sexual wellness. Many men anticipate that each self-pleasure session will culminate in powerful orgasms and robust erections that are reminiscent of their youth. However, they abandon the practice entirely after experiencing disappointing results. This perfectionist mentality induces performance pressure, which in turn induces stress hormones that impede pleasure and arousal. The body interprets this pressure as a threat, causing blood vessels to constrict and muscles to tense, which is the exact opposite of what is necessary for a sexual response. Rather, prioritize sensation, relaxation, and exploration over specific outcomes by adopting a process-oriented approach. Engagement in the practice itself should be the metric by which success is evaluated, with any gratifying sensations being regarded as welcome bonuses rather than necessary outcomes. Another critical error is inconsistent practice, in which males engage in self-pleasure only occasionally or when they are particularly motivated. The physiological systems that underpin sexual function are not sustained by this sporadic approach. Penile tissues experience inadequate blood flow, nerve sensitivity decreases, and pertinent muscle groups deteriorate when sexual expression is infrequent. Furthermore, the hormonal advantages that result from consistent sexual activity, such as the reduction of stress hormones and the maintenance of testosterone, necessitate consistency in order to generate substantial health benefits. For optimal physiological advantages, establish a consistent schedule for self-pleasure, which is typically 2 to 3 times per week. Consider this as maintenance rather than recreation, similar to the way that consistent exercise maintains muscle function regardless of motivation. This consistent approach preserves physical capacity, which facilitates spontaneous engagement when the desire arises. The third significant error is the inordinate emphasis on the genital response, which results in the neglect of the body's overall pleasure potential. The full spectrum of sensual experience is bypassed by many men, who exclusively focus on obtaining erections and approach self-pleasure with a narrow genital focus. Performance pressure is not the only consequence of this restricted approach. It also fails to capitalize on opportunities to identify novel pathways to delight that become increasingly significant as conventional patterns evolve with age. Rather, broaden your perspective to encompass the entirety of your body as an erogenous landscape. Investigate the sensitive areas of the inner thighs, lower abdomen, perineum, nipples, and other areas that can produce pleasure and subsequently improve the genital response through contact. This holistic approach activates a greater number of neural pathways, enhances overall arousal, and frequently indirectly enhances the genital response, all while providing gratifying sensations, even in the absence of a complete erection or orgasm. A fourth common error that undermines success is the hasty completion of the process. Many men approach self-pleasure with the same time-efficient mindset they apply to other duties, aiming to achieve arousal and completion as soon as possible. This hasty method is rarely effective with elderly bodies, which typically necessitate more time to respond to stimulation. A negative cycle is initiated when arousal fails to occur promptly, leading to frustration. The mature male sexual response is significantly enhanced by protracted arousal periods that facilitate the progressive and consistent development of blood flow. Allocate a minimum of 30 to 45 minutes for self-pleasure sessions, considering this time as an investment in both immediate pleasure and long-term functionality. Utilize the initial portion for non-genital contact and relaxation, gradually transitioning to more direct stimulation as arousal increases. This patient approach frequently results in stronger, more gratifying experiences and generates significantly better results than hurried attempts. Perhaps the most detrimental error is the practice of self-pleasure in conjunction with feelings of shame or humiliation, as this establishes a counterproductive correlation between sexuality and negative emotions. Limited arousal, restricted respiration, and tension are the physical manifestations of this psychological conflict. The body is unable to completely relax into pleasure while concurrently experiencing guilt as a result of that experience. In order to resolve this issue, it is important to actively engage in self-permission and positive affirmation regarding your sexual orientation. Remind yourself that this practice is consistent with medical evidence and represents appropriate care for your overall health. To bolster the legitimacy of sexual expression, it is advisable to document and periodically evaluate its health benefits. Many males find it beneficial to formally designate self-care time in their calendar, recognizing its significance in conjunction with other health practices, such as exercise or medical appointments. By avoiding these common errors, you eliminate the primary obstacles that impede the successful reclamation of sexual wellness in the future. It is important to remind oneself that the majority of obstacles in this field can be resolved in a practical manner when approached with the appropriate information and attitude. Those who approach changes with flexibility, perseverance, and determination are the most successful males in maintaining lifelong sexual wellness, whether they have the fewest health challenges or not. Each positive experience generates momentum for the subsequent one, resulting in an upward spiral of development rather than the downward spiral that ensues when these errors are neglected. Regardless of your starting point, you create the conditions for natural delight to flourish again by making a conscious effort to avoid these hazards. The comprehensive restoration method is a systematic approach that is specifically designed for men over 55 to re-establish and maintain sexual wellness through mindful self-pleasure. Allow me to share this with you. This is a comprehensive wellness practice that addresses both the physical and psychological aspects of in later years, rather than a fast cure. This method, which has been refined through consultation with urologists, sexual health therapists, and feedback from hundreds of men who have successfully navigated these adjustments, combines traditional knowledge with a contemporary medical understanding of male sexual physiology. In contrast to generic advice that fails to consider age-related changes, each element of this methodology is tailored to the unique obstacles that males face in their sixth decade and beyond. This method's roots can be traced back to the pioneering work in sexual health rehabilitation that occurred after prostate surgery. Researchers discovered that regular, appropriate sexual stimulation considerably enhanced recuperation rates and maintained function. These principles were subsequently further developed through research conducted at sexual wellness clinics that specialize in geriatric populations. The therapeutic approaches used to maintain sexual function without medication demonstrated remarkable success. The adaptability of this method to a wide range of circumstances was demonstrated through its refinement through real-world implementation with men who were struggling with a variety of health conditions, such as diabetes, arthritis, heart disease, and medication adverse effects. This is what makes it particularly valuable. In this approach, the fundamental insight is that sexual function is governed by the principle of neuroplasticity. Pathways that are consistently activated are maintained and fortified by the brain and body. The restoration method is a 5-step process that should be executed on a 2 to 3 times per week basis. Initially, the preparatory phase, which lasts for 5 to 10 minutes, entails the establishment of a private environment that is comfortable, has a suitable temperature, is positioned with cushions if necessary, and is free of distractions. Before commencing, apply a quarter-sized quantity of high-quality lubricant to your palms to warm them. Secondly, the relaxation phase, which lasts for 5 to 10 minutes, emphasizes the progressive relaxation of muscles and deep breathing. It commences with the conscious release of tension throughout the body, commencing with 10 calm breaths. Third, the awakening phase, which lasts for 10 to 15 minutes, entails the exploration of non-genital pleasure by applying gentle contact to the inner thighs, lower abdomen, chest, and other sensitive areas. This process progressively increases awareness of sensation without the use of goal-oriented reasoning. The fourth phase, focus stimulation, which lasts for 10 to 15 minutes, involves the use of 3 specific techniques to introduce direct contact. The encompassing palm method involves the lubricated palm encircling the penis with mild pressure and gradual, full-length movements. The gland circulation technique involves the use of 2 fingertips to create small circular motions around the head of the penis, applying slightly firmer pressure. The root strengthening approach involves the application of moderate pressure and massage to the base of the penis and perineum area to enhance the connections between the pelvic floor and blood flow. Maintain these movements with attention to any gratifying sensations, regardless of the state of erection, rather than concentrating on rigid expectations of response. Lastly, the integration phase, which lasts for 5 minutes, entails a conscious appreciation for the experience, regardless of specific outcomes, and a few moments to acknowledge the health benefits of the practice you have completed. This phase is characterized by mindful awareness of sensations throughout the body. Timing and frequency are critical for achieving the best possible outcomes. In order to ensure consistent circulation and hormonal benefits, the optimal practice schedule for most males over 55 is 3 sessions per week, preferably distributed uniformly throughout the week. The optimal time for these sessions is typically mid-morning, between 9 to 11 a.m., when testosterone levels are naturally higher for the majority of males. Alternatively, if the morning is not feasible, the sessions can be scheduled for the early evening. Between 5 to 7 p.m. sessions should be avoided when the individual is exceedingly fatigued, immediately following a substantial meal, or when time is a constraint. Schedule sessions to coincide with the optimal effectiveness periods if you are taking ED medications. It is advisable for men with cardiovascular issues to refrain from practicing immediately following physical exertion, as the heart is already working harder. Schedule sessions after heated showers or during periods of mild activity when joints are at their most flexible for individuals with arthritis. For sustainable integration, I suggest that this method be implemented gradually over a 3-week period. In the first week, concentrate on the re-establishment of positive associations and body awareness by practicing only the first 3 phases, preparation, relaxation, and awakening, without genital contact. In the second week, introduce the focus stimulation phase with moderate pressure and without any expectations of outcome, while maintaining an inquisitive, exploratory attitude. In the third week, implement the entire 5-phase practice, progressively increasing the duration of time spent in the areas that you find most advantageous. Maintain a wellness journal to document your experiences, including changes in mood, sensation, response, and overall well-being. Many men report that they experience significant improvements in sensitivity and response within 4 to 6 weeks of consistent practice. Additionally, they often experience benefits to their energy levels, temperament, and sleep quality even earlier. Let us pause to reflect on the topics we have addressed in our pursuit of reclaiming sexual wellness in later life. We have found that the maintenance of sexual expression through appropriate self-stimulation is not merely a transient pleasure, but rather a critical aspect of complete health for men over the age of 55. We have examined the impact of the mind-body connection on sexual wellness, and we have identified and addressed common misconceptions that cause men to prematurely forsake this aspect of their lives. Additionally, we have developed practical strategies for collaborating with your changing body rather than against it. We have analyzed the most prevalent errors that impede progress and have developed an exhaustive, step-by-step approach that is tailored to the mature male body. This information provides a comprehensive framework for the preservation or restoration of this essential aspect of your identity and health. The advantages that can be anticipated from the implementation of these practices are not limited to the boudoir. Many men report that within the first few weeks of consistent practice, they experience an improvement in mood, reduced stress levels, and enhanced sleep quality. The hormonal benefits of sexual expression, such as the release of endorphin and oxytocin, result in significant enhancements in emotional stability and outlook. Most men experience improved circulation to the genital area, enhanced sensitivity, more reliable arousal, and stronger pelvic floor muscles that support both sexual and urinary function in the medium term, typically within 2 to 3 months of consistent practice. Numerous individuals report that their reliance on erectile medications is reduced or that their efficacy is improved when medications are administered. The long-term advantages that have been documented in men who adhere to these practices for a year or more include a substantial reduction in the incidence of prostate issues, enhanced cognitive function, improved cardiovascular health markers, and the preservation of muscle mass and bone density through hormonal optimization. Imagine awaking in 6 months with a rekindled sense of vitality, feeling reconnected to a part of yourself that you had dreaded was permanently lost. Visualize the assurance that results from acknowledging that you have taken responsibility for this aspect of your health, rather than consenting to its decline. Take into account the potential positive impact of this reclamation on your intimate relationships, whether they are with a current companion or potential future connections. Visualize the satisfaction of preserving your optimal health by utilizing self-care and knowledge, rather than succumbing to despair. Many men who effectively implement these practices report a significant transformation in their relationship with aging, transitioning from a perspective of inescapable decline to one of adaptation and ongoing development. Improved nutrition, increased physical activity, and greater social engagement are frequently the result of this renewed relationship with your body, which in turn inspires positive changes in other areas. Recall that this transformation is a voyage rather than a destination. As with any significant health practice, it necessitates a willingness to adapt, consistency, and fortitude as your body undergoes ongoing transformation. You are not alone in this endeavor. Few men candidly discuss the changes that millions of men are navigating, despite the fact that they are the same. The silence that surrounds male sexuality in later years creates the illusion of uniqueness in your experience, despite the fact that these changes and challenges are universal aspects of the male aging process. It is advisable to participate in online communities or discussion groups where males can exchange their experiences and strategies for preserving sexual wellness throughout their lives. Numerous men discover that breaking the seclusion surrounding this subject offers them supplementary motivation and practical insights that improve their personal practice. I urge you to approach this aspect of your health with the same level of commitment and attention to detail as you would when managing your blood pressure, maintaining cardiac health, or preventing diabetes. Your health maintenance plan should prioritize sexual wellness, not in spite of your age, but as a result of it. The preventative benefits of regular sexual expression become more significant as you progress through your 60s, 70s, and beyond, rather than less so. Commit to the restoration method for a minimum of 90 days in order to obtain substantial benefits. Schedule these sessions in your calendar as non-negotiable appointments with yourself, assigning them the same level of importance as any significant health intervention. Patience, consistency, inquiry, and compassion toward oneself are the qualities that will be most beneficial to you during this voyage. Progress may not always proceed in a linear manner. As with any health practice, there will be days that are better than others. The most successful men are those who approach setbacks with inquiry rather than judgment, regarding them as information rather than failure. Each experience, regardless of whether it is instantaneously gratifying or not, offers valuable feedback that aids in the refinement of your approach. Through consistent practice and the knowledge you currently possess, you have the ability to preserve or re-establish this fundamental aspect of your humanity for the duration of your life. This will not only improve your longevity, but also improve your experience of being alive in each instant. In this video, we have explored a subject that is rarely addressed, yet is crucial for men in their later years. The manner in which your overall health, longevity, and quality of life are directly influenced by the maintenance of sexual wellness through appropriate self-pleasure. We have dismantled harmful misconceptions about sexuality and aging, investigated the science behind the connection between sexual expression and health outcomes, identified common errors that impede progress, and provided a comprehensive step-by-step method that is specifically tailored for men over 55. The most significant change is that we have transformed self-pleasure from a concept that is frequently associated with shame or dismissal to what it is truly, a fundamental form of self-care that has significant implications for your emotional, mental, and physical health as you age. The information you currently possess has the potential to significantly improve your health trajectory, but only if you implement it. No change is generated by knowledge that is not implemented. I urge you to commence the restoration method today, rather than waiting until the circumstances are ideal or the following week. Prompt action is crucial for the preservation of sexual function, as the biological mechanisms that maintain it operate on a use it or lose it principle. It is important to bear in mind that the restoration process may become more difficult with each passing day. Despite initial uncertainties, the men who achieve the most remarkable advancements are invariably those who commence promptly and maintain consistency. The dedication you demonstrate today to this component of your comprehensive health maintenance will be greatly appreciated by your future self. If you found this information to be valuable, please consider liking this video and subscribing to our channel. Your straightforward click facilitates the dissemination of this critical information to other men who would otherwise not have access to such candid, practical advice on this subject. The algorithms that determine video visibility directly respond to these engagement signals, enabling us to disrupt the isolation surrounding men's sexual health in later years. Please consider sharing this video with acquaintances who may find it beneficial. Occasionally, the most valuable gift we can provide is the opportunity to address topics that have been unduly prohibited for an extended period. I am grateful for your openness and foresight in discussing this critical information. I trust that you will experience a sense of empowerment and preparedness to reclaim this critical aspect of your health and humanity.